Hey guys, what's up? So it's Dennis again. Today we're going to be talking about HPV, human papilloma virus. So let's go straight to the topic. HPV is a sexually transmitted disease or infection. Like we say, it's called human papilloma virus. It affects both men and women. So what are some of the symptoms of HPV? So you will experience vaginal warts and warts on the penis. So in general, we say genital warts. So warts will be some cluster-led rough structures or say rashes that will come on your genital organ or your private part. Those ones are just the beginning, they are just low risk symptoms. So other symptoms that will give you or a sign that it is becoming cancerous include with women, discoloration of your cervix, even ulceration that we saw at the cervix, and then frequent lower abdominal pain. Frequent lower abdominal pain with women. Painful intercourse. You know, when the cervix is ulcerative, sex can be a bit painful. So with men, you experience warts on your genital organ as well. So in general, both men and women, you experience symptoms of painful swallowing and painful throat, enlarged lymph nodes. So you see under your throat here be swollen, under your jaw here will be swollen, the lymph node will be enlarged. Furthermore, you will have other symptoms of ear pains and what have you. So HPV is very dangerous. So let's know how dangerous it is. How does it affect men and women further? Let's discuss based on fertility, the ability for a couple or a union to be fertile, be able to reproduce. How does HPV influence that? Let's start firstly with men. HPV interferes with the sperm cells movement. You know, when sperm cells are released, they have to move into the uterus to the fallopian tube to be able to fertilize any egg that will be released from the ovary. So the movement of sperm cells is influenced by the virus. So you realize that from this picture, the virus attacks the sperm cells from the head, preventing the cells from moving to its direction to function rightfully. So in that case, fertilization will not happen. So that's how HPV causes infertility in men. Let's discuss women. So with women, the virus interferes with your fallopian tube, causes blockage. It will block the tube that sperm cells or egg will not flow for the sperm and the egg to meet for fertilization to happen. A certain portion of the fallopian tube called the ampulla. So fertilization will not happen because of those structures that have been deposited in the tube as a result of the HPV virus. Another way it includes cervical mucus. So you realize that the normal cervical mucus that every woman will experience after their regular menses, the one that will be thick, and then it can just cut immediately you extend your fingers, is a sign of infertility as a result of HPV virus. So now all the time, women, when you see wet fluid, maybe about a week or two after your menses, you see wet fluid, you start complaining that infection, you will take antibiotics. Stop taking antibiotics every month. Many women say they are flushing out infections. Stop taking antibiotics that is not being prescribed by your health worker. So those are signs and symptoms of how HPV will affect fertility in a couple. Those are things that you will notice. These are ways in which it happens. Now let's go and see how does HPV also affect pregnancy. Okay, luckily, by the grace of God, you get pregnant. But then HPV has a way of affecting pregnancy. Number one, it will cause intrauterine growth restriction. The child be very, very tight in your stomach can get big. The baby just growing slowly. So if you go to the midwife, she go check you this month, you realize that she say you 14 weeks. So when you're 14 weeks today, after 1 month, we expect additional 4 weeks to add to your 14 weeks, making it 18 weeks. When you go there, she check you again, you say it's 16 weeks. That means the growth is not increasing. Because 14, then 2 weeks added, say 16. So it'll be 4 weeks now. It should be 4 weeks. So it affects the growth of the fetus in the womb. The next one is fetal death. It can kill the baby in the womb. It can kill the baby in the womb. Followed by preterm birth. The woman reached 9 months and she gave birth. With 7 months to 8 months, the virus can cause that to happen. Preterm birth. Then there's another one called preterm premature rupture of the membrane. So the baby water bag around it, amniotic fluid, will burst even before 9 months. That's the meaning of the preterm premature rupture of the membrane. The word preterm added to a meaning the pregnancy is not at term, ain't reached 9 months yet, and then the water bed bursts. The virus can cause it. Another way it includes cervical insufficiency. That is, the virus weakens the cervix that it cannot hold pregnancy. You have frequent miscarriages. So some women who experience miscarriages frequently. Not all miscarriages is as a result of HPV, don't get me wrong, but it is advisable that you do your HPV test as well when you are investigating for the causes of the miscarriages. So it weakens the cervix. That's it. And the virus also interferes with implantation of the embryo. So let's say a man and a woman's sperm cells and egg will meet and fertilize, then come into the uterus to be attached to the wall of the uterus for it to develop into a baby fetus to a baby. Now the process of attachment, the virus will interfere with it. So what happens next is all the product will come out. Miscarriage will happen again. So this is how dangerous HPV is. How can we prevent this HPV? Vaccines for HPV is now available in Liberia. So go and get your vaccines. Vaccines is available. Get on 2. Avoid too much sexual activities. Too many sexual or multiple sexual partners. Multiple. 3. Healthy diet can also help you to prevent HPV, because what happens is that it builds your immune system. Remember, we say HPV can be asymptomatic, but based on your body immunity, it goes away without treatment. So healthy diet and regular exercises can help maintain you correctly, perfectly. So in talking about prevention, let's know who are at risk of this particular disease. Number 1 person, we repeat that again. A person with multiple sexual partner is at risk of catching HPV. Always control your health and your habit. A person who does not receive the vaccines is at risk of having HPV. What are the age ranges? At age 12, fine, it happens, but mostly where the age person is really involved into sexual activities at age 15 and above. Most likely, on the average in general, age 15 and above are at risk of having HPV, most especially the ones that are not vaccinated. So hey, HPV is deadly. Let's keep safe. How do we treat HPV? You are not going to treat HPV online. Go to your hospital, see your doctors, get advice. There are other chemicals they use to burn those warts to get them away. Other procedure they do, like removing those warts, called cryotherapy. They remove the warts. It's a surgical procedure. So let's please keep safe. HPV is dangerous. Thanks for watching. Again, I'm Odysseus B. Dennis, a physician assistant and Bachelor of Biomedical Science. Please like and share. Follow this page and get more knowledge. Thank you.